Hello, hello, my friends. Welcome back to the Fertility Confidence Podcast. Thank you so much for hitting play today. Before we get into today's episode, which is for our male partners, we're talking all about varicoceles. And if you don't know what that is or how it can impact male fertility, definitely stick around. But before we get into that, a quick thank you to our amazing podcast sponsor, Needed. One of the male products we've actually been using quite a bit inside Fertility Confidence Method for our male clients is their Needed men's prenatal. It's very similar to the female prenatal, but has wonderful amounts of high quality antioxidant support for that sperm health. It can help with count, motility, morphology, DNA fragmentation. We love that. We love a one-stop shop that we can get everything that we need. So thank you so much, Needed, for offering us 20% off your first order with the code Dr. Kelsey, and you can check out the men's Needed prenatal, but also any of the Needed products over at thisisneeded.com. So let's talk about varicoceles. They are something that do not get enough attention, honestly, and have such a large impact on male fertility. So this episode is for you if you guys are floundering in the male fertility department, feeling frustrated, feeling unsure of where to go from here. Maybe you've had a semen analysis done and you've been told everything looks great, but you know, because you are a Fertility Confidence podcast listener or you follow me over on Instagram, that everything looks good on a semen analysis actually usually isn't optimal. There is a vast difference between what is considered normal in fertility clinics and on labs versus what is considered optimal when we're talking about sperm health to make a baby. And so this is something we see quite a bit with our clients inside Fertility Confidence Method, where their partners have been given a gold star. They've been told everything looks good. It's not you. You don't need to do anything. And when we review their semen analysis, I'm going, oh, actually going to take that gold star away. There actually is some room for improvement. And if you're curious what that looks like, I encourage you to check out His Confidence, which is our mini male fertility course. And I actually walk you through what labs to run, how to interpret them for optimal levels versus just normal, what to do about it, and all the research around different supplements, nutrition, and lifestyle factors that can improve male factor fertility. Because you have to remember, this is like a really important piece of all of this. Fertility is a whole couple journey. It's not just one or the other. 60% of infertility cases actually have both female and male factor infertility. So we can't just look at one side of the equation. And this is something I often see getting forgotten about in the male realm. We talked about this inside office hours in FCM today, actually, where it's very common for couples, if something is found in the female, if they know they have endometriosis or PCOS or what have you, then they just assume that's the only problem and they stop looking for other issues when fertility can be a multifaceted complex problem. We need to make sure that even if we have a diagnosis, we're actually still doing a full investigation. And that means even if female factor fertility has been found, we still need to look at the male side of things. So let's get into it. What is a varicocele? It's basically like a varicose vein. I'm sure all of you have heard the term like spider veins. And when you get older, you can like start to see your veins in your legs and your lower limbs. That's basically what a varicocele is, but it's happening in the scrotum. So in the pouch of skin that holds the testicles. And when those veins become enlarged, they swell, they can become twisted, and it causes blood to pool. And we have to kind of consider this sort of like a plumbing issue, right? The tubes where the blood flows in and around the testicles and in the scrotum is getting backed up. And this is going to cause a problem for a variety of reasons that we'll get into in just a second. Varicoceles are actually one of the most common causes of male factor infertility. And yet we're not assessing them across the board, even in men who have suboptimal numbers, meaning they're not terrible, but they're not good, and we're missing things. So 15% of all men, infertile or fertile, actually have varicoceles, and around 40% of men who have been labeled as infertile have a varicocele. That's nearly half. That's a big number. So if you are having numbers that aren't looking optimal on your semen analysis, but you haven't been assessed for a varicocele, we're missing a big potential root cause piece that, by the way, is treatable and fixable. So we really need to make sure that we're advocating for this as a potential diagnosis, and not just if your semen analysis is deemed abnormal, but even if it's below optimal. And again, we get into that inside his confidence and, of course, fertility confidence method as well. The annoying part with varicoceles is men might not have any symptoms. So I get asked this question quite a bit of like, well, okay, if this is going on, like, how do we know? And the only way to know truly is to do physical exam. However, some men, depending on the size and severity of the varicocele, may feel a sort of dull, aching sensation in their scrotum, particularly that gets worse after standing for long periods of time, because obviously gravity or physical activity. It might feel heavy in the scrotum. And I would say, I mean, obviously, I don't have a scrotum, so I don't know for sure. Maybe I should ask Tyler this question. And if he hears this when he's recording, he might die that I'm talking about his scrotum. But it's okay. We're all friends here, right? I'm sure in men, and men, you can DM me and correct me. I'm sure there's some degree of like physical sensation with standing for too long or with prolonged heat exposure. So this isn't just like a one-off kind of symptom. This is something that you're experiencing, maybe not daily, but pretty darn close to. You might also be able to actually feel the enlarged vein in school when we're learning. So when I was in naturopathic medical college, we learned all around doing physical exams for both men and women. I'm trained to do pap tests. I was trained to assess prostates. This is not something I ever used in practice, but we learned it. And so one of the things was to actually feel and palpate for enlarged veins in the scrotum. And they say it kind of feels like a bag of worms, because normally you don't really feel those veins, like maybe a little bit, but these are obviously thicker because they're dilated. That's what a varicose vein is. So doing self exams, you can monitor like that feels different, right? And if it feels different, we should be assessing. It also can actually shrink the testicle, because if we're impacting blood flow, it's going to impact the organ. So that's another thing to kind of think about. So if your partner's ever complaining of any weird sensations, it's honest to goodness, even if their semen analysis is fine, it's still worthwhile to just get checked, right? And make sure that everything is okay. How you're going to be diagnosed is through two things. One, a physical exam through their doctor, ideally a urologist, because they're likely just going to have a better tactile feel of being the person who does this all the time versus your family doctor, who might not really know what they're feeling for. It might just not be a skill that they've honed in on, whereas a urologist, that is their job. So I always recommend to clients, when a semen analysis isn't perfect, we're getting a referral for urology, just to have a better workup and assessment done with a doctor that specializes in that area. They're also going to want to do a scrotal ultrasound, because sometimes the varicoceles are small enough that you can't actually really feel them, or it's challenging to feel them, whereas an ultrasound will be able to show if there's any pockets of blood pooling in the area. It's quick, it's painless. Sure, is it awesome to have to ultrasound your scrotum? I'm sure it's not, right? But for men that are listening, I encourage you all to remember all the different things your female counterparts have had to do on this journey, or are going to have to do on this journey, that are way more invasive, and they're likely happening more frequently versus you doing this one ultrasound. Okay, we're gonna put that one in the memory bank, right? So that's how we're gonna look. We need an ultrasound and we need a physical exam. From there, and depending on what your semen analysis numbers look like, we're also, of course, going to want to run some blood work. We're not going to see anything in the blood work that would specifically point to varicocele, but we still want to rule out any other potential causes of poor quality or low quantity sperm. So we don't want to skip that step of looking at your hormones, looking at your metabolic health. All of that is important, and all of that's outlined for you inside Labs 101, which I can pop a link in the show notes, as well as his confidence. How this is actually impacting your infertility is through two kind of main ways. One, physical blockages. So if the veins are dilating enough that they are impacting the other tubes that are carrying various fluids and sperm, that's a problem. But the even bigger issue with the varicocele is actually the heat that it can cause. When blood is pooling, blood is warm, right? And we know from our previous podcast episode, Hot Balls, which is episode number 101, and I'll link that one below if you haven't listened to it. I highly recommend it because the research on how heat impacts sperm is fascinating, and I found some really cool studies, and this is one of those areas that can just heat up the scrotum. And if there's excessive, even I say excessive loosely because the temperature gradient change isn't that high, which is crazy. I'm talking like 1 degree Celsius can negatively impact sperm. And when we're looking at the heat exposure and short periods of time, that's a problem. When we're talking about a varicocele, we're talking about continuous excessive, AKA 1 degree, but excessive heat exposure all the time. It doesn't go away because it's always there. Now heat's becoming an even more bigger problem. One of the areas it's so funny I'm recording this today because we did actually talk about heat inside our FCM office hours a few different times for clients today. And I haven't personally seen any research or data on could icing the testicles without doing the varicocele surgery, but could icing have a positive impact? I haven't seen it. In terms of data, I think it would be an interesting study for them to run. And we know that cooling off the testicles does make a difference. So I think that would be worthwhile to talk about. But when we have too much heat in the scrotum, and again, go and listen to episode 101, just get more detail, but we're going to see lower sperm counts, lower motility, and more sperm DNA damage. So higher levels of DNA fragmentation, which we do not see this number on a standard semen analysis. A semen analysis is looking at how many are there, how well do they swim, and what do they look like on the outside? Whereas DNA fragmentation looks at what are they looking like genetically on the inside. They can be a perfect sperm and you can have lots of them, but if they all are a good, let's say 30% of them are actually shit genetically on the inside, they're not going to do anything for you. So that DNA fragmentation, that's a really big piece that they just don't test for off the bat, but we probably should be. Knowing how male factor fertility is declining, this is something that we should likely look into sooner rather than later. So there's multiple ways in which varicoceles, unfortunately, can negatively impact fertility. How we treat, so like I just said, will cooling down the area have a positive impact? I'm not sure. Logically, it makes sense. Do we have the studies? Not that I've seen at this time. Typically, what they recommend is something called a varicocelectomy, which is basically where they go in and they tie off that vein so that blood can't pool in that area and it's shunted into healthier veins. And this can happen anywhere in your body, where the wall of the veins basically just get weak. And so instead of the blood just continuing to go down the line that they should, the vein swells and the blood dilates and it impacts blood flow. And we can have that. It happens for women, especially a lot in their feet and their hands and their extremities, where the blood, pools down and then we don't have the strong circulation to push it back up. This is how spider veins happen. It's kind of the same deal. So they basically work to bypass those veins that just, for whatever reason, aren't healthy anymore, to redirect it into new veins. Yes, does that sound scary? Sure. Again, as a non-scrotum owner, I'm sure there's a lot more nerve-wracking thought that has to go into that, but it's quick, it's relatively painless. I would be curious if anyone out there has ever had a varicocelectomy as well as a vasectomy and would let us know, like, what is the recovery time? Typically, it's fairly quick. You're like, you maybe should rest that day, maybe the next day, but then you should be able to resume normal activities. The thing with the varicocelectomy and fertility that's really important to know is that it can take 3 to 6 months to see improvement because sperm need time to regenerate. And we also need time from a heat perspective to help with the mitochondria and things in that area. So the data does show on average 3 to 6 months post-surgery before we're actually starting to see improvements in sperm. So again, another big nod to investigating this sooner rather than later is important for your fertility space, because the longer we wait, and then now we're like, okay, we found this, we're going to do the surgery. Maybe you have to wait for the surgery because they're busy. And then you got to wait 3 to 6 months to even see if it's going to work. And about 70% of men that do the varicocelectomy do see improvements in their sperm health. And studies do show that pregnancy rates can increase by 30 to 50% after varicocelectomy. No, it's not a perfect system. And again, I think that really points towards the fact that varicoceles might not be the only issue. But if you're in the camp of a 50% improvement in pregnancy rates, that's well worth it, in my opinion. It's not the same as let's try IUI and give you, 5% chance of getting pregnant. We're 30 to 50%, 70% of men see improvement in sperm levels, and then 30 to 50% actually do have improved pregnancy rates. Why those numbers differ is likely because it's a multifactorial piece. There's likely other things going on, and that might also be female factor fertility as well. One thing that's come up in our community recently is like, how do we know if we need surgery, right? Like, how do we know that the surgery is worth it? And what happens if we don't do the surgery? And I would say what I've seen is it does depend on size. And I don't have a specific number for you because it does seem to be very urologist specific of what they deem is small enough to ignore. And those are maybe the varicoceles that I would say, hey, let's try the icing or the cold showers to see if that helps. Whereas a larger one, it's a no-brainer. Doing the surgery makes the most sense. Not treating could potentially just continue to decrease sperm numbers. So if your numbers already aren't good, I would say doing the surgery makes the most sense. If your numbers are fine, like optimal fine, not just normal fine, but you have a varicocele, is it worth treating? In that case, from a fertility lens, probably not. However, long-term down the road, you might have more discomfort, more of that like dull aching feeling. And it might be easier for you to do the surgery younger versus older. But that's obviously a very personal decision. Okay. So the moral of the story is if you have suboptimal sperm levels or low sperm levels and you have not been assessed for a varicocele, what the heck is going on? You are not getting gold standard care. I need you to get a second opinion and you need a urology referral. It's quite literally that simple. Even if you don't have symptoms, your symptoms might just be bad sperm numbers. Those are the things we want to look into. The other piece here is that your sperm numbers might look fine on a standard semen analysis, but your DNA fragmentation is high. I would then still have a proper assessment for varicoceles because perhaps the heat aspect is not necessarily impacting your production because maybe your body's really great at making sperm, but it is impacting the actual DNA integrity of the sperm. So it's kind of a two-prong approach here. And if your numbers are great, this is likely something, and your DNA frag is fine, this is likely something we don't have to look into, which is great. We can check that box off. But if you're still trying to figure out why the numbers are the way that they are, and you haven't had this assessment done, it's well worth pushing for that urology referral. I had mentioned a few different ways you can learn more about male factor fertility in the episode. The first, obviously, being coming and joining us inside Fertility Confidence Method, where we're going to build out your custom care plan for you, for both of you, because this is a whole couple approach. If you want to take all of the guesswork and questions off of your plate, if you want support, that's where I would encourage you to go. And book a call. They're free. We're going to get to know you better and see if FCM is a good fit for you. Second option being our His Confidence program, which is just our mini program on male factor fertility specifically. We're going to talk and show you all about the different testing, how to interpret it, what is optimal versus normal, and then based on your numbers, what to do about it. Or if you're just curious about the testing and what that looks like, check out Fertility Labs 101, and I'll make sure all of those links are in the show notes for you, as well as some of our other male factor fertility podcast episodes, so you can go and check those out. And I will see you guys in the next episode.